Hi guys, how are you doing? It's Elaine, Bintz, certified health coach and personal trainer, and we are on day 18 of our 30-day health challenge. I hope everybody is having a great week, and I hope your new year is getting started off on a great foot. So today's topic is a continuation of a series of strength ratio videos. So today is the third in our series. 2 days ago, we went over the shoulder joint, and then yesterday we discussed the elbow joint, and today we are discussing the lumbar spine. So where is the lumbar spine? So in your spine, you have cervical at the neck, and then thoracic at the rib cage, and then lumbar, which is your low back. So we're talking about this bottom area here. So this particular section of the spine, why are we discussing this? I think the numbers might even be higher. I think the last time I checked, the research said that 80% of Americans will experience low back pain at some point in their life. So as a personal trainer and a person who works in the healing arts, it makes sense that I would want to make sure that my clients not only have a strong lumbar spine or low back, I also want to make sure they have a strong core. That's everything really, from the shoulders, hips, from the back and the front of the body, but specifically lumbar spine. So the area we're mainly focusing would be the low back area here, top of the glutes, and the bottom of like the lats and the trapezius. So this ratio, the movements we're looking at are flexion and extension. So for your low back, you flex this area using your iliopsoas and your abdominals. So anytime you're doing like this motion, that would be flexion of your lumbar spine, and then extension would be moving back. So you're using more of your erector spinae, or the muscles that go right along your spine. They help you stay erect, or they keep your body upright. And I'm actually going to attach a picture that has all these ratios. I'm using this information from my professional organization, which is ACE, which is the American Council on Exercise. So I'll go ahead and attach this so you can have all the numbers handy for the joint we're working on, the movement, the muscles, and then the ratio. So this one now, lumbar spine flexion and extension, again, we want to have a 1-to-1 ratio. You're going to notice that's a very common theme. So what does that actually mean? You want a 1-to-1 strength ratio. So let's take a plate, for example. So if you had a 10-pound plate, and a motion you were going to be doing for lumbar spine flexion might be like a weighted sit-up. And now if you do have back problems, you definitely don't want to do this motion. But if you have no back discomfort and this is not a contraindication, an exercise you shouldn't do, you can grab a weight. It could be a 5 or 10-pound plate. If you could do flexion, so that's the motion of like a sit-up, and you can do 10 pounds with that motion, then hopefully you could use the same amount of weight for what is called lumbar spine extension, or moving backward. So you would then hold the 10-pound plate in front of you so that you strengthen the backside of your body. So again, please remember, please don't try these exercises if you are having some sort of an injury, or you are in physical therapy or rehabbing something. Even if it's just pain and discomfort and maybe not an all-out injury, I definitely don't want you to get injured at home. I'm hopefully using this information so you can apply it to your own life and to help you with assessments. So some of the problems some people will have is depending on the body and the way they carry their weight. They might have more pressure in the lumbar area, which makes extension, that motion in everyday living, more challenging. But as Americans, we tend to sit in this position, or the activities that we're doing, maybe reclining, we're maybe keeping this area tight. So what some people might confuse as a weakness is actually a muscle tightness. So you might need to actually open up the hip area in order to be able to strengthen the lumbar region, even in the front of the body. So that we'll talk a little bit more about the hip tomorrow in the hip video. But again, this is the lumbar spine. I hope everybody is having a great day. Again, my name is Elaine Bintz, health coach, personal trainer, and I look forward to seeing you tomorrow. Have a great day. Bye.